So I'm Isabel. Hi everyone. So lovely to see familiar faces and lots of new faces here, and having a full house is really amazing. So again, I'm Isabel, and I'm here to talk about some of the policy work I've been doing since graduation. So Brianda, if you could go to the next slide, please. So this presentation is really about my journey from being a therapist who loves doing one-on-one work to somehow doing policy work. How did that happen? You guys will find out in a little bit. But I will share what I learned through the Public Policy Academy, and mostly I want to talk about the growth that came with it, how I grew as a clinician, how I grew as a person, and the connections that I made while doing very, very meaningful work. So, who I am. I'm a 24, almost 25-year-old Boricua. Any Boricuas in the house? Yes, period, good, glad. I've lived in the diaspora, so like probably many of us, I have learned to live in the in-between, right? I just graduated from Teachers College, Columbia University, from the Bilingual Mental Health Counseling Program. Thank you. I know there's a bunch of the bilingual cohort here, and our amazing advisor, Dr. Kiara Manosalvas. So if it weren't for y'all in that community, I do not think I would be standing on the stage. So thank you so much for your support and everything that we are able to learn together. What else about me? Oh, clinical passions and research passions has to do surrounding Latino voices and really helping the community and providing that bilingual and bicultural care. And also, I am currently on the job market. I was doing the fellowship up until last month, so I've had a bit of a break, but I'm going to pursue my clinical work and my limited permit in mental health counseling here in New York. And I just moved back to New York on Saturday, so I'm very happy to be local again after a few months of a hiatus in New Jersey, just across the river. But yeah, so if you guys are looking for LPs or know people or ways in which I can help you with your work, please let me know. Great, so I first want to give a bit of context as to how I got this fellowship, where it's from, all of that. So this was through the Hispanic and Latino Behavioral Health Center of Excellence at the Universidad Central del Caribe in Bayamón, Puerto Rico, and it is a SAMHSA-funded center. So basically it works as a Latino behavioral health hub, if you will, right? So it incorporates a lot of trainings, supports, resources for providers and clinicians to provide bilingual care, multicultural care, and be able to be there for the Latino community. And one of the really cool initiatives is the Public Policy Academy, where they take 10 students from across the nation to work with states who have seen an influx of Latino migration, but they do not have the precedents or the policies to support them in a behavioral health sense. And through that Policy Academy, which is what I did the past few months, almost a year, since January, that's where I really got to learn about the power of collaboration when it comes to Latino behavioral health in policy, bringing together people in government, community leaders, healthcare providers, and with all the same goal is to improve Latino behavioral health in the states, in our communities. So that's the Academy, and I actually want to, next slide, want to share a bit of why I chose to do this policy work. And to be quite frank, I didn't really choose this. It kind of found me in a way. So this opportunity came about during my second year of my master's when I was, figuring out what was next for me, right? In our program, the pipeline is usually you do go straight to clinical work, right? But I was also debating going back to research, maybe doing a PhD, continuing going to school and avoiding adulting for a bit, or teaching, consulting, right? So there was a lot of different things that I was considering. And I had been connected with the center since my first year of my master's through my bilingual counseling skills class. Our professor had recommended the center because of their trainings. She's like, it's a great way to not only connect with other providers, but also learn and expand our knowledge of how to help the Latino community through behavioral health and mental health. And so I was already subscribed to their newsletter. I had been to a bunch of their trainings, their talks, their webinars, and got the email, was immediately interested and hooked, right? And, I was one of 10 students in the group, and I was really nervous at first because I don't know about you guys, but being in the mental health field, I didn't know anything about policy. I did work in community mental health during my master's, and that also inspired me to go into policy. because as many of you guys know, working with clients and seeing that they're constantly facing these systemic barriers, you kind of start to think, does the system also need therapy too, you know? Oh, wait, actually, could you go back, please? So that's kind of what really inspired me to do this work. And once we were in the academy, the first few months had to do with just like a crash course of learning about what policy was. Everybody had different varying levels of understanding of what policy was, and they were all from different behavioral health sectors. So there's some public health people, some people who have done policy before, but there's people like me, like mental health counseling. I'm like, I don't know what policy is. Like, I've heard of it, I know it has impact, but I don't know what it is. They're social workers. So it was a great mix of students that we all have very different perspectives, again, with all the same goal of improving Latino behavioral health through policy work. And so I got assigned to the state of North Carolina with one other student, and I got to work with their Department of Health and Human Services, as well as the nonprofit El Futuro, which is a Latino nonprofit in North Carolina that provides bilingual services to North Carolinians. So there's gonna be some stats, so I might read a little bit more off my phone, so I apologize for that. But we want to start with the landscape, right? And really just get understanding of what is going on in the state, right? So a lot of my research method skills were at play during this phase of the policy process. So the disparities were very clear when we looked at the landscape. In North Carolina, Latino residents make up over 10% of the population, and that is expected to double by 2050. Yet almost every county faces a behavioral health provider shortage, or what they call a mental health desert. And almost a third of Latinos are uninsured. So there's a lot of different disparities, a lot of different barriers that our community faces to access this care. And this means that people are struggling alone, not because they don't want care, but because the system isn't built for them, right? So it showed me how deeply systemic inequities affect mental health, and how important it is that bilingual and bicultural providers, as us in this room, right, have a seat at every table where change is happening, right? We also saw that the state was focusing heavily on workforce development to address these disparities, so we decided to kind of go in that same direction, right? Because unfortunately, due to very unprecedented changes happening, Yep. I'm trying to be very nice about it, right? But also very frank. There's a lot of scary changes happening that also affected some of the work that I was doing. And there was a point where this policy work was not going to be done because it was a SAMHSA-funded project, right? There was 2 months where we didn't know that if this work was going to continue. So we went through all the changes. We complied with SAMHSA. The center itself had to change their wording, their mission, all these things. But still with the same goal, right, is to help the community, right? So trying to work with these limits while still providing the support and care that our community needs. So yeah, we saw it as a timely opportunity. We're like, okay, let's go in the same direction as the state is going so that we're able to still help support our community and get state support. So after doing the landscape analysis and going through various stages of brainstorming and figuring out what we wanted to do, we came up with these 3 policies. So the first one is creating a community mental health worker credential in the state of North Carolina. So these are basically people who are already doing the work but do not have the proper recognition in the state. And it's to help create that pathway. Then the second one is kind of in addition to, is to get Medicaid reimbursement for community health, mental health workers. Because again, this is creating the pathway, but this is going to help make it sustainable and continue on, right? And we presented these 2 policies at a conference in early September to the other states that participated in the Public Policy Academy, and it was a great time. It was all these amazing Latino change makers all in a room, again, with the same mission, to help and support our community in the behavioral health sense. And it was really great because we were the first state to actually present, so that was nice. And we got a lot of feedback from other states. They're like, oh, in our state, we have a credentialing for community mental health workers. And it's like, oh, that's awesome. So we were getting a lot of this feedback about systems and pathways that already exist in other states, which is important because sometimes these states don't talk to each other. These different systems don't speak to each other. But these pathways, these policies exist. So why not implement them in other places, right? So then as we kept talking with different states, actually 3 different states, the state of Maryland, Connecticut, and Georgia, they brought up that they have actually a Spanish language peer support specialist training. So when we presented our findings, we were debating whether or not making it community mental health work oriented, like promotores, or going peer support specialists. But we were like, okay, we're thinking too big, let's just choose one. We went community mental health worker. But then we got that feedback and we're like, okay, then this is something that is possible and that already exists. So then after doing the presentation and submitting our final product to the center, we also created the 3rd policy of the Spanish language peer support specialist training. So all of these have the same impact, that it's to help build up the workforce to address these mental health worker shortages and also supporting our community at the same time. So what I learned as a therapist, so this is for y'all, for all of us. So this really reshaped how I view therapy and how I view our work. I realized that systems, just like people, they have stories, defenses, blind spots, emotions. And just like in therapy, change happens across these sectors as well. And it can happen with people like us at the table. It also became a form of applied empathy for me. I got to apply a lot of my counseling skills into this work, being relational, having cultural skills. And it reminded me that healing doesn't only happen in the therapy room. It happens in the way we design these systems, we fund these systems, and uplift the voices that have been ignored for so long. So personally, this experience brought about something that I wasn't really expecting, and that was a community. First of all, this, also for additional context, it was a completely virtual and remote fellowship. So it was really hard to connect with people on a virtual platform. But thankfully, they did have 2 different in-person retreats where we first got to meet the students, and then the final phase of the academy was meeting with the students, all of the stakeholders, all of the states, and the whole administration of the center. I found myself surrounded by very brilliant, passionate students and mentors that looked like me, spoke my languages, and had the same passions and drive to care for our community. We laughed, we debated, we had good food, we sang, we danced, and built relationships that I know will last throughout my whole entire career. And it reminded me that policy doesn't have to be heavy, despite the times that we live in. It is joyful, relational, and deeply human. I also wanted to highlight that this was a very full circle moment for me. I got the chance to visit the center in La UCC in Puerto Rico, right? After almost 2 years of knowing the center, I was able to actually go in person when I went to go visit family this past summer. And I got to go with my mom, who actually graduated from her master's from La UCC. So it was very emotional for me and for her as well, right? Seeing her pride and seeing how our lives have intersected back at La UCC after 20, 25 years of being outside of the island. And it reminded me that this type of change isn't just, this change and this work isn't just with us. It starts with the generation before, and it helps to prepare the generation that comes. So if there's one message I hope you take away today, is that policy isn't this distant bureaucratic thing. It's people work. It's about relationships, compassion, and cultural wisdom. We lead with community voices and data that honors lived experience, and we can create real sustainable change. And when therapists, especially BIPOC therapists like us in this room, show up in these policy spaces, the entire system becomes more humane, more just, and more connected. Thank you so much for listening and for all the work you're doing. Thank you.